Chris Cook. Well, let's get two medical perspectives on this now from Lord Winston, the reproductive health expert and labour peer, and Rachel Clarke, a junior doctor who's worked at A&E. Good evening to you both. Lord Winston, first of all, the financial gap is a given. Does there have to be some radical change?
Well, I think one of the first things that the government has to think about is that how has it managed to disincentivise what are the most altruistic, most well-qualified, most intelligent workforces that are in the country. Since the age of 16, these people have been wanting to go into the health service, and now they're wanting to leave it early.
And wanting to go into the health service and being trained at a very high level at great cost.
At great cost, so that now, for example, one of the key issues with the A&E is that now, of course, general practitioners are wanting to leave because they are so disincentivised because of the way they restructured the health service with the disastrous 2012 Act.
So, Rachel, as someone who worked in A&E a year ago, tell me the good things and tell me the bad things.
So before you start your first A&E job, people say to you, it's a battleground, it's a battlefield, and it is. There is blood and gore and drunks and abuse, but none of that actually makes it bad necessarily. That makes it an environment where you can strive to be the best doctor you can save lives every day. It could be everything you want as a medical career. But the brutal truth of the matter is, in every A&E rota there are gaps among the junior doctors, but there's no restriction in the number of patients coming in. So the doctors who are left are now having to do the jobs of maybe two, maybe even more doctors, and that is unbearable. You literally may have someone in bed 1 who has just had a life-threatening heart attack, someone in bed 2 who's had a stroke, both their lives in your hands. But how can you look after them both?
But tell me, the Lincolnshire Hospital is thinking of closing at night. Isn't that an unthinkable thing?
It's absolutely catastrophic. What that means is millions of people in that environment suddenly are going to be denied emergency care. They will go to other A&Es, they will swamp the other A&Es that probably also have gaps in their rotas. And the idea that this is happening up and down the country, and the Health Secretary is turning a blind eye to it. He's not being upfront about it.
Let's just turn to what you think,
well, I don't
for example, might be done to alleviate this situation.
Well, one of the things that we should not do, of course, is to have a ridiculous argument with the junior hospital doctors over working at weekends when we're closing hospitals at night time because we can't cope. That shows the paucity of proper thinking from the Secretary of State.
But give me a radical solution.
Well, first of all, he should tell the truth about really what happens at weekends and why, in fact, the deaths that he's recording aren't related to staffing. That would be... It's very important, actually, for the health service not to be a political football. And we're in a situation where the Tory party is unopposed by a very weak opposition, and that doesn't help either.
Well, moving away and moving to you and looking at you with your medical hat on, what do you think could be done, particularly in A&E? For example, I would say to you, it's a very unpopular thing to say, I would say to you that perhaps patients are part of the problem.
Then I think you have to go to primary care, and you have to look at actually how primary care is being delivered. And the fact of the moment is that most general practitioners are totally dissatisfied because they are running the health service as commissioners rather than looking after patients.
But what do you do in A&E? What do you do in hospitals? Do you bring in private patients? What do you do?
Well, what we could do with private practice, and I'm speaking as a member of the Labour Party, what we could do is to say we will have private practice, but we will make sure that it's actually inside the health service, so the profit goes to the health service and not to private providers who can at the moment tender outside the health service. So wait a minute,
so what you would have is you might have an A&E, and you would go to A&E, but actually, if you could afford to pay, you would go faster.
It wouldn't help A&E.
May I offer 2 other suggestions as someone who works still in A&E? One is, you have to be honest and candid about the lack of doctors, and you have to recruit more of them. Now, Jeremy Hunt and his government don't want to do that because it's expensive, it costs money. But if we don't do that, we are denying the population a safe standard of care. So that's one thing. Secondly, and this is something that your film admitted to make clear, what those statistics didn't point out is that year on year, since 2010, the share of GDP that this government spends on health has gone down. It is now 6.6%,
we are
almost the lowest in Europe.
The sheer percentage of GDP is one of the lower in Europe. But let's just actually have practical solutions. how do you educate patients about going to A&E and not going to A&E for a start?
You've got to provide the primary care with the general practitioners, and if the general practitioners are not there, they will have to go to A&E. That's what's happening. That's currently what's happening.
I routinely will see patients who range from the life-threateningly sick, the ones in resuscitation on death's door, to people who come in because, and this is a real example, they've had a tummy ache for 30 years. Now, you can say, of course, that end of the extreme shouldn't be there, but if you're a worried mother who's told by a GP receptionist it'll be 3 weeks before you get your child to see a GP, what are you going to do? The crisis isn't just in A&Es, it's in general practice as well. There are 50% gaps in some GP training rotas as well as A&E rotas, so there's nowhere for the patients to go. And if the government will not be honest, will not fulfil their duty of candour with the electorate to become clean about that, then they are being dangerous and they are threatening and endangering patients.
But once before, Gordon Brown put a penny on national insurance, hypothecated it for the NHS. Is it time to hypothecate taxation for the NHS?
I don't think hypothecated taxes are the right way to do this at all, and I think very few people who work in the health service believe that's really the answer. I think what we've done is to create a structure which is really very, very unwieldy. Your film really focuses on so many different problems.
Yeah, but
that's one of the
that
issues.
question, let me just put that to you. The NHS is not fit for purpose. Now, it's not just to do with money, it's about the way we deliver our health care.
The way we deliver it and the way we, in fact, encourage staff to come into it, and the fact we're making it difficult to recruit staff. I mean, we don't even give work experience to young people who are considering going into the health service. That's very poorly provided for. There are all sorts of things at every level which have not been thought through in a constructive way.
Why is it impossible to have this kind of debate?
Because we've made the health service into political football, and we're not having, absolutely, as Rachel says, we're not having an honest debate. So, and until we do, that's going to be a major problem.
And so I would say one of the problems is, Sir Robert Francis, who famously investigated the horrors of mid-staffs, he said, junior doctors are the eyes and ears of the health service, and we see things crumbling around us at the moment, and we are packed full of solutions. We know how to do things differently. The government could listen to us. Instead, they impose policies from on high, such as the notorious 7-day NHS, and that's a disastrous way to do things.
Thank you both very much indeed.